So today we will be talking about leadership and advocacy. So leadership refers to the practice of guiding schools and programs to provide an inclusive and compliant education. So when we talk about leadership, we're talking about four things: legal compliance, advocacy, inclusive practices, family and community engagement. First, when we talk about legal compliance, we're ensuring that all of the IEPs for each individualized student meets the needs and the standards under IDEA and guarantees a free, appropriate public education. Advocacy allows access to technology, resources, and other supports that support the students. So when we advocate for students, we are basically using our voices if they can't or are not old enough to get them the modifications that they need. Inclusive practices, integrating students with disabilities into general education classrooms. So an inclusive practice, many of my students are itinerant, and that means that they receive their instruction in the general education classroom, but they will come down to the learning support room to take tests or to have a quieter setting while working. Family and community engagement, partnering with parents and guardians to ensure that they are heard and their voices are heard, and that they're also involved in their students' process of the IEP. So many ways that you can communicate with families could be email, phone call, Class Dojo, and other apps that are now being implemented into schools for teachers and parents to connect. There are four types of leadership. The first one is servant leadership. This focuses on serving the needs of students, families, and staff through empathy, collaboration, and support. So this type of leadership, lots of collaboration is going on. Transformational leadership. This motivates educators to work towards shared goals, inspires growth, innovation, and school improvement. When we talk about shared goals, we're talking about two teachers coming together with the same goals for a student, a teacher and a parent coming together for the goals of that student. Transactional leadership uses structure, expectations, rewards, and consequences to maintain accountability and organization. And then emotional leadership emphasizes emotional intelligence and relationship building to support students, families, and staff. When we talk about advocacy, advocacy refers to it ensures that students with disabilities are receiving an equitable access to their education. So first, we're going to enforce rights, and how we do that is that we're ensuring that the schools and the professionals in the schools are providing FAPE, which is free, appropriate public education. Secondly, we're going to empower families. So in order to empower families, we are advocating for the families and the students to help bridge the gap between parents and school districts. So it's important to communicate daily and effectively with those parents. Thirdly, we're documenting data. So all data should be documented, whether it's positive or negative. And communication logs with parents or guardians should be documented. Documentation of what meetings were, when meetings were, how they were, and what was discussed should also be documented. And then when we talk about data, it's important to focus on data such as the child's progress, either positive or negative. Inside of the classroom, we could also discuss it outside of the classroom, at home, in a public setting, related to their goals. So each student who has an IEP has goals. So this evidence is concrete to determine if what is being done is helping the student. When we talk about collaboration with stakeholders, we are being aware and consistent, and ensures that all interventions and practices are carrying over in all of the settings. It also helps to ensure that all assessments on the child are the same needs in all different settings, and all resources that can be helpful to the student even outside of school. So when we talk about who is going to be collaborating with stakeholders, it would be teachers and administrators, families, related service providers, and community agencies. In an IEP meeting, you do have an LEA, which would be the special education director or a principal. Teachers, you need a gen ed teacher and the special ed teacher. Families, mom, dad, grandma, whoever's taking care of the child. Community agencies, so those would be outside agencies coming in to talk about transitional assessments, and then related service providers. So we could have a speech therapist, OT, PT, any of those. When we talk about evidence-based practices, they're instructional strategies, interventions, and programs that are supported by scientific research and data to prove that something is effective in learning outcomes. So some strategies could be explicit structure and modeling, formative assessments, targeted feedback, and prompting, which are all evidence-based practices. And some resources that you can use is the U.S. Department of Education. Family and community engagement. So when we talk about how teachers communicate with family and community and how to engage them in their students' process of education, the importance is that students have improved outcomes, family empowerment, and teacher support. So some strategies, so you can give input, like an input form before a meeting. So you send home the input form to parents and guardians that they can fill out to help ensure that their goals and their concerns and their desires for their child are being met. Communicating daily with these people. So when establishing communication methods with each family and communicating daily on positive and negative behaviors. And some resources. We're going to connect families and schools to local organizations and advocacy groups that can help these students. So these create a wide support system that helps family and students have access to vocational supports, especially when the student just turned 14 and we're talking about transition assessments. When we address challenges, we have to manage the behaviors. So some ways that we can manage behaviors could be classroom routines. I know visual schedules help. A daily schedule that doesn't change to kind of help the students come into the school and understand where they're going and what they're doing. So it's very structured and it creates predictable and secure environments for the students. Some sensory interventions, so incorporating some breaks or fidgets to help the students regulate on their own. I know I teach 7th and 8th grade, and it does help my kids at that age. And then behavior plans. So we're going to work with other specialists and parents and the IEP team to identify the student-specific triggers and implement a positive behavior support plan that rewards the students' positive outcomes. When we're differentiating instruction, especially with challenges, we're modifying assessments and lessons for the students. And then with the IEP, we're ensuring that the IEP is reviewed regularly. All IEPs need to have a meeting at least once per year, and that it's tailored to the student's abilities. Some key strategies that could help would be structured classroom routines, leveraging assistive technology, and promoting inclusive environments and fostering communication between the student, the parents, other administration, other teachers. And then our action plans. So we have 4 steps to this. The first step is going to be assessment and data analysis. So we're going to identify gaps and review baseline data. And how we're going to do that, we're going to look at graduation and dropout rates. We're going to look at discipline referrals and inclusion in the least restrictive environment. The second step is going to be team building. So we're going to train and coach staff and empower families. So we can do that with workshops and coaching for students with disabilities so that they can actively participate in their own IEP meetings. Once they hit the age of 14 to 16, they should be, actively participating, having their say. Collaborating, so we're going to connect all families with local family centers and advocacy networks. There's one in Pennsylvania called the PEAL, PEAL Center, that shares resources and training. Step 3 is supporting the workforce and staying informed. So we're going to retain special education teachers by providing ongoing professional development, manageable caseloads, and supportive induction programs. How to stay informed would be monitoring any legislative action to ensure that the local policies align with the federal protections, and utilizing resources from advocacy bodies like the ARC. And step 4, we're going to progress monitor and set goals. So in order to do that, we're going to apply targeted interventions to specific areas of need, tracking progress throughout the school year. How to prepare for meetings, ensuring parents and advocates to review all of the assessment reports and fill out all of the parent input before the meeting. And then we are going to talk about all of that at the meeting.